Let's talk about the H influenza vaccine for babies. Hi, I'm Dr. Brittany Todd. I am a pharmacist. First, I want to start with what is it? H influenza sounds like the flu, but it's not. It's actually a bacteria that when you get it, it requires strong antibiotics. It can cause epiglottitis, which is just swelling in the throat. It can cause ear infections, meningitis if it gets serious, pneumonia if it gets serious. But most of the time, it's a very mild, treatable disease. Now, the H influenza vaccines came out in the 1980s. Before that, there were about 1,000 deaths per year from H influenza, generally in children under the age of 5. Now we have very few deaths per year from H influenza. The vaccines have been shown to significantly reduce the risk of developing or contracting H influenza in children. What's interesting is there were two types of vaccines studied in the 1980s. There was a polysaccharide form and a conjugate H influenza, and the polysaccharide one was found to be not beneficial at all in children under the age of 2. The ones we currently use are the conjugate H influenza type B vaccines because those were the ones that were shown to be effective. Now, there's only been one ever saline placebo trial with H influenza vaccine. It was looking at the vaccine versus saline in Alaskan Native infants. In that one saline trial, they used a conjugate vaccine and it was not effective. Now, the studies where the H influenza vaccine was found to be effective studied that vaccine against other vaccines like meningococcal or just the general childhood vaccination schedule. Either the children got all of the vaccines plus the H influenza, or they got just all of the vaccines without the H influenza vaccine. They also studied it against an aluminum adjuvant, which I've said in the past is not an inert substance. So safety is in question when it comes to the H influenza vaccine because it has never been studied against an actual saline placebo, except in one small study where it wasn't actually effective. Now, of course, in those studies, they said that the H influenza vaccine was safe and effective compared to meningococcal, other vaccines, or aluminum adjuvant. But we do know that H influenza, in general, is a mild disease and it is treatable. So the risk versus benefit is always up to you, and that's why I give you these videos so you can decide as a parent what you want to do for your child. Of note, the only child I have ever personally known who had H influenza was fully vaccinated for H influenza, and it took them 5 days of being in the pediatric ICU in the hospital to get him the right antibiotics because they knew he was vaccinated, so they didn't think they needed to cover for H influenza, when it turns out that's exactly what he needed.